In this video, we will review the bones of the pelvis, including the ilium, the ischium, and the pubis, as well as a brief look at the sacrum, the sacroiliac joints, and the pubic symphysis. We will begin by observing a lateral view of the ilium, ischium, and pubis. In the mature adult, these three bones are fused together to form one bone known as the innominate or os coxa. The three bones meet here near the center of the hip socket. In children, they are separated by a Y-shaped cartilage, while in adults, the bones fuse together to form one structure, leaving little to no trace of their prior separation. The ilium is the largest and most superior of the three hip bones. Its broad, wing-shaped surface is known as the ala, while its curved, superior margin is known as the iliac crest. The iliac crest features a prominent tubercle and terminates anteriorly in what is known as the anterior superior iliac spine, or ASIS. Below it, another prominent region is known as the anterior inferior iliac spine, or AIIS. Returning to the iliac crest, we can move posteriorly to find the posterior superior iliac spine, or PSIS, and below it, the posterior inferior iliac spine, or PIIS. Switching to an anterior view gives us another angle of the anterior superior iliac spine, as well as the anterior inferior iliac spine, and also allows us to visualize this shallow depression known as the iliac fossa and the anterior aspect of the sacroiliac joint. By removing the sacrum, we can see the articular surfaces of the sacroiliac joint here on the ilium and here on the sacrum. Because these surfaces resemble the shape of a human ear, they may also be referred to as the auricular surfaces. We will conclude our tour of the ilium with a posterior view, allowing us to once again visualize the posterior superior iliac spine and posterior inferior iliac spine. From here, we'll move inferiorly to take a look at the ischium. This bone features a prominent pointed projection known as the ischial spine and a large roughened protuberance known as the ischial tuberosity. We'll rotate the model slightly to observe more of the body of the ischium, which also forms a portion of the hip socket known as the acetabulum, and also to allow us to observe this bar-like projection of bone here known as the ischial ramus. The ischial ramus meets with the inferior pubic ramus, and both bones form part of the border of this large opening known as the obturator foramen. Rotating the model again, we can see the greater sciatic notch located above the ischial spine and the lesser sciatic notch located below it. In an intact human body, the sciatic nerve would emerge here from the greater sciatic notch. The ischial tuberosity would serve as the site of origin for the hamstring muscles, as well as being a weight-bearing bone when sitting. And the obturator foramen would be mostly covered by a connective tissue structure known as the obturator membrane. Returning to an anterior view allows us to observe the features of the pubis. Its most anterior aspect, the body, features a prominent projection known as the pubic tubercle, while these branches of bone here and here are known as the superior pubic ramus and the inferior pubic ramus. Connecting the left and right pubic bones is a joint featuring a fibrocartilage pad known as the pubic symphysis. We will conclude our look at the pelvis by returning to the hip socket known as the acetabulum. This area will be explored in greater depth in a subsequent video on the hip.